You're listening to Empyrean's podcast, Benefits and Beyond. This podcast is a collaborative production involving both artificial intelligence and human creators, blending machine-generated and human-curated content.
All right, so we're diving into burnout in healthcare today, specifically what employers can actually do about it. You sent over that Empyrean Benefit Solutions article, and it really got me thinking. It's easy to say, we appreciate you, but what concrete steps can healthcare employers actually take?
That's the million-dollar question, right? And this article really digs into that. Honestly, the numbers on nurse burnout are kind of shocking.
Yeah, that statistic about nurses wanting to leave the profession was really eye-opening. The article mentioned an AMN healthcare survey. Almost a third of nurses are ready to bail. I mean, that's a huge chunk of the workforce. What kind of impact is that going to have if we don't, fix this?
It's a critical question. We can't ignore the ripple effect this could have. If a third of nurses are gone, who's left to provide care? It's a scary thought. We need solutions, and fast.
No kidding.
Yeah.
And if those numbers weren't bad enough, the article also talked about a study by the American Hospital Association. 2/3 of nurses are already feeling burnt out. Even if they're not quitting, that's got to be affecting their well-being.
And here's where it gets really interesting. The article goes deeper into the reasons behind this. Yeah, long hours and huge workloads play a role, especially with the nursing shortage. But it really highlights these systemic issues and a lack of support.
So it's not about nurses needing to just suck it up.
Exactly. The article points out this big disconnect between what nurses need and what employers are giving them.
Makes you wonder what needs to change.
Right. And one thing that really jumped out at me, something we don't talk about enough, is workplace violence. Did you know 8 in 10 nurses have experienced some kind of workplace violence, according to National Nurses United?
Wow, 8 out of 10. I knew it was a problem, but that's intense. What kind of violence are we talking about here?
It runs the gamut, unfortunately. The article talks about verbal abuse, a lot of it from patients or family members. It's demeaning and emotionally draining, and sometimes it escalates. Physical assault, threats, situations that put nurses in real danger. It's no wonder they're burning out with that constant stress and fear.
It's just heartbreaking. These are people who dedicate their lives to caring for others, and they're facing this kind of hostility at work. It's just not right.
It's not, and that's what makes this article so important. It doesn't just dwell on the problem. It gives us a way forward, a 6-step roadmap for healthcare employers to make things better, to create a safer and more supportive environment.
Okay, so walk me through it. What's step one? Where do employers even begin to tackle this?
The article is really big on creating a culture of empathy and support. It's about going beyond just saying the words. Employers need to actually acknowledge that burnout is a real widespread problem.
So no more sweeping it under the rug.
Exactly. Nurses need to feel comfortable talking about their struggles, without being judged or punished for it.
It's about being able to say, hey, I'm not okay, and having someone actually listen and understand.
Exactly. And the article stresses that this has to start at the top. Leaders have to set the example, show that they're truly committed to their employees' well-being.
So creating that culture of empathy is key. But then what? How do you actually go from talking about burnout to actually doing something about it?
And that's where this article gets really good. It gives you these concrete steps, a roadmap. Step 2 is all about giving leaders and managers the skills and resources they need to actually support their teams.
That's right, because it's one thing to say you value well-being, but managers need to know how to actually do that day to day.
Absolutely. It talks about training programs, not just these superficial check-ins, but really equipping managers to spot burnout, to have those tough conversations with empathy, and to connect their team members with resources.
So it's about moving away from just being task-oriented and actually prioritizing the well-being of the team.
Exactly. And like we were saying, this cultural shift has to come from the top. Leaders need to walk the walk, take care of themselves and show that they're serious about creating a healthier workplace.
Which leads perfectly into step 3, actually implementing those well-being programs and benefits. Actions speak louder than words, right?
Absolutely. This is where it gets exciting because they offer a lot of practical solutions. A big one, obviously, is mental health support. The article really emphasizes making sure all healthcare workers have access to affordable mental health resources.
Okay, like what? What are we talking about here?
Well, things like on-site counseling services, access to therapists who specialize in burnout, compassion fatigue.
I was going to ask about that term, compassion fatigue. I don't hear that one every day. What does that even mean?
Oh, sure. Compassion fatigue is basically a state of emotional and physical exhaustion that happens to people in caregiving roles, like nurses. It's that cumulative toll of caring for others, especially when those people are suffering. It can look like emotional detachment, trouble feeling empathy, and even physical stuff like fatigue or insomnia.
So it's kind of like a specific type of burnout that's unique to helping professions.
Exactly. And it's easy to miss because it gets mixed in with the regular stress of the job. But it's so important to recognize it and treat it.
So having therapists who really get that, who specialize in compassion fatigue, is huge.
It's essential. And it's not just therapy. The article also talks about mindfulness programs, meditation, yoga, things like that, to help nurses build coping skills and resilience.
Giving them the tools to handle stress and take care of themselves, even when they're not at work.
Exactly. And here's where things get really interesting. The article also makes this connection between financial well-being and burnout.
I have to admit, when I think about burnout solutions, I usually jump to mental health or maybe more flexible work schedules. Finances don't usually spring to mind. How are those connected?
It's actually a huge factor. A lot of nurses are dealing with financial stress, whether it's student loans, childcare costs, or just, the cost of living. That constant worry about money takes a toll. It can really contribute to burnout.
So it's not enough to just feel appreciated. They need to feel financially secure too.
Right. And they offer some really innovative ideas in this area. For example, they suggest employers look into offering financial counseling services as part of their benefits package. So nurses would have access to someone who can help them get their finances in order, maybe help with debt management, budgeting, things like that.
That would be huge, having someone in your corner like that.
Exactly. And they even take it a step further. The article suggests that employers think about offering student loan assistance programs. Can you imagine the impact, especially for nurses just starting out with all that debt?
That's a game changer. I mean, pizza parties are nice and all, but that kind of tangible financial support could really change someone's life.
Yeah, offering financial counseling, helping with student loans, that's getting to the root of the problem in a way we don't often see. It really is. Well-being isn't just about how you feel emotionally, right? It's about feeling financially secure, too. That constant stress about money really holds people back. And that kind of leads us to another important piece of this roadmap.
Okay, let's hear it.
We talked about those alarming stats on workplace violence against nurses, and the article really digs into that. Creating a safe environment is absolutely crucial if you want to address burnout.
Makes sense. What good is a well-being program if nurses are still getting abused or threatened at work? What does the article suggest employers actually do about it?
It talks about a multi-pronged approach. It all starts with a safety audit, looking at the work environment itself and identifying any potential problems.
So things like, are the security protocols strong enough? Do they need better alarm systems? Even just the layout of the workplace, could that be improved?
Exactly. It's about getting ahead of the problem, not just reacting to it. But it goes beyond that, too. The article really pushes for a zero-tolerance policy towards violence against healthcare workers.
Zero tolerance. That says a pretty clear message.
It does. It means any act of violence, verbal, physical threats, it's all taken seriously, and there are consequences. But it's not enough to just have the policy, right? You have to enforce it consistently, actually show that you care about their safety.
Back up the words with actions.
Yes. And it's not just about punishment, it's about prevention, too. The article recommends regular training for all staff, de-escalation techniques, conflict resolution, how to recognize and respond to situations that could turn violent.
Give them the tools and the confidence to handle those situations, to protect themselves.
Exactly. And finally, they emphasize the importance of having a system for reporting these incidents that's both easy to use and confidential.
Right, because nurses need to feel safe speaking up, without fear of retaliation.
Absolutely. It's about fostering this culture where people are encouraged to speak up, where they know they'll be taken seriously. Looking at these steps, it really highlights how much of this is about changing the entire culture.
I was just thinking the same thing. It's not just about adding a program here or a policy there. It's about shifting the whole way we think about and prioritize the well-being of healthcare workers.
Yes, and that takes real, sustained commitment from everyone. From the top down, this isn't a quick fix, it's an ongoing process.
And it's about recognizing that investing in the well-being of nurses isn't just the nice thing to do, it's the smart thing to do. If your workforce is burned out, everybody loses. The nurses themselves, obviously, but also the quality of care suffers. It's not sustainable long-term.
You're absolutely right. This deep dive into burnout has been really eye-opening. A lot to think about.
It really has. And it's not just about listening and agreeing, right? This article gave us a framework, a place to start. So I hope everyone listening, nurses, healthcare leaders, even just anyone who cares about the future of healthcare, I hope you'll think about what you can do to be a part of the solution. What really resonated with you today? What questions are you still wrestling with?
That's what's great about these deep dives. They spark more questions, which keeps the conversation going.
Thanks for joining us today. If you enjoyed this episode, please subscribe and follow us on LinkedIn. We'll be back with more great content in our next episode.